Hello, my name is Alyssa Fotopoulos, and today I will be presenting my PICOT practice change presentation, which involves magnesium sulfate as a primary treatment for childhood asthma exacerbation. I'll start off with an introduction, and then I will discuss the significance of the problem. I'll then present my PICOT question, and then I will describe the search strategy I used to answer my PICOT question. I'll then discuss the evidence I found in relation to my search. Then I'll discuss the change model that I would use to implement my change. I would then discuss the data-based collection and evaluation of the data collected from the implementation. I'll then discuss dissemination of the practice change, and I'll wrap up with a conclusion. I'm a registered nurse. I have 4 years of experience in pediatric critical care. I do have a Bachelor of Science in Nursing degree, and I am currently seeking out my Master of Science in Nursing Family Nurse Practitioner specialization at the University of St. Augustine for Health Sciences. I'm interested in this topic because of my background in pediatrics, and as well as the prevalence of childhood asthma. Asthma is the most common chronic disease of childhood. In fact, it affects more than 6 million children in the United States. As a pediatric critical care nurse, I've seen asthma really take an impact on children, and unfortunately, some of them do end up in the critical care unit due to their asthma symptoms. 1 in 6 children in the United States with asthma visit the emergency department for asthma each year. 1 in 20 children in the United States with asthma are admitted to the hospital each year due to their asthma symptoms. It is the #1 reason for pediatric emergency room visits, and it's one of the top 3 contributors to pediatric hospital admissions. The United States spends an estimated $9.3 billion per year on healthcare costs that are related to pediatric asthma. The current management of pediatric asthma exacerbation includes oxygen therapy, continuous short-acting beta-2 agonist inhalation, and systemic corticosteroids. Currently, magnesium sulfate is listed only as an adjunct therapy to be used during a pediatric asthma exacerbation. Due to the significance and prevalence of pediatric asthma, there may be room for changes to the standard management of pediatric asthma exacerbation. And this is what led me to form my PICOT question of, in children experiencing an asthma exacerbation, what is the effect of the administration of magnesium sulfate on respiratory symptoms compared with children experiencing an asthma exacerbation who did not receive magnesium sulfate? I did not want to include a time in my PICOT question due to not wanting to limit the amount of research that I could find if there were differences in the administration time of magnesium sulfate. My search strategy to help answer my PICOT question started with the search engines USA Search Platform and Google Scholar. I initially limited the years for articles to 2015 to 2020 publication dates, and I also started with the key phrases magnesium sulfate and asthma exacerbation, as well as in children. This initially gave me over 200 non-duplicate citations from both of these search engines. I then decided to apply some inclusion criteria, which included full text, peer-reviewed, PICU, as well as the keywords PICU, emergency, or hospital. And then I also included the phrase children or adolescents or youth or child or teenager. I was able to utilize the Boolean terms and or. This then decreased the number of articles I had to 55. Still realizing I needed to make this number a tad smaller, I included the exclusion criteria of adults, anesthesia, and ketamine. And ultimately, after a full text screen, as well as data extraction, this allowed me to yield 5 articles to include in my evidence. And I got those from the databases CINAHL Complete, Gale, Science Direct, and Medline. The 5 articles that I found through my search included 2 systematic reviews and 3 primary research studies. I was able to find 4 main ideas that were common throughout these 5 articles. The first is the use of magnesium sulfate alone, either intravenously or inhaled. The second was the use of magnesium sulfate with a beta-2 agonist. The third was the outcome that the article had was focused on improving lung function. And the fourth was outcomes that were focused on decreasing hospital admissions and decreasing the length of stay. I was able to surmise the two following statements of evidence to support my change. The first, IV magnesium sulfate administration showed to have significant improvements in lung function of children suffering from an asthma exacerbation, and it significantly decreased the number of hospital admissions due to asthma. The second, IV or inhaled magnesium sulfate used with a beta-2 agonist significantly improved lung function in children suffering from an asthma exacerbation when compared to each treatment being used alone. After reviewing this evidence, I decided that the use of a high-dose infusion of magnesium sulfate over 2 hours would be the most effective way to deliver the treatment during my implementation phase to yield the best results. Now that I had the evidence to answer my PICOT question, I now had to decide how to implement this change. I decided that the best place to implement this change would be the emergency department setting, especially an emergency department that frequently treats children. The main stakeholders during my change process would be emergency department and pediatric inpatient department physicians, nursing supervisors, and charge nurses. I chose the diffusion of interventions model to implement my change. This is a 5-step model that involves the steps of knowledge, persuasion, decision, implementation, and confirmation. For the knowledge stage, this is when my stakeholders would become aware of the change. I would likely present my change project in a small, intimate setting in the form of a presentation. I would then begin the persuasion stage following my presentation by having the stakeholders form an opinion of my change. Ideally, this would lead to the stakeholders making a decision that would be a positive decision regarding they would form a positive opinion about my change and therefore would then make the decision to help engage in activation of my change. This would then lead to the implementation phase, which would involve putting the change into practice. The last step would be the confirmation step, which would involve reviewing the change results and evaluating them to make sure that the change was effective. Once my change project has been approved, I would then start the database collection and evaluation phases. To begin the collection phase, I would determine that the outcome to be measured would be lung function prior to, during, and following magnesium sulfate administration through the intravenous route. The data measured in the collection of data would be ratio and ordinal data. The ratio data that I would include would be respiratory rate and pulse oximeter saturation. This is considered ratio data because both of these have an absolute zero, and there's meaning between the increments of each of the results of this data. For ordinal data, this would be lung sounds and work of breathing. There's no absolute zero with ordinal data, which neither of these do have an absolute zero. For data collection, I would utilize a chart review. This is where the nurses would be able to chart prior to, during, and following the treatment, and therefore would be the best place to follow up with information, to gather information. The design of the study of the implementation would be measurement of data before, during, and after treatment. The time of the collection would be during a patient's emergency department visit during the fall months, and the time would be infusion over 2 hours. That's how long the magnesium would infuse. Nurses in the emergency department will collect the data, and then a team of chart reviewers will then review the data for result analysis. Evaluation of the data would include evaluating the dependent outcome variables, which would be the respiratory rate, the pulse oximeter saturation numbers, work of breathing, and lung sounds. The data analysis that would be used would be either paired t-test or Wilcoxon signed rank test. Both of these are able to be used for the same group that is measured prior to and after an intervention. After I would have the change results from my institutional practice change, which would be at my hospital in the at Madigan Army Medical Center, I would then consider presenting my project to the local hospital, which would be the local children's hospital, being Mary Bridge Children's Hospital. After I would be able to present there, if it was successful at that level, I would then consider a regional hospital, which would be Seattle Children's Hospital. If again my change practice would be successful in that venue, I would then consider national venues. And one of the venues I would definitely consider presenting my change project at would be the Advanced Pediatric Emergency Medicine Assembly. And this is a conference that is full of basically all medical providers that provide care to pediatrics in the emergency department. It includes nurses, doctors, physicians, PAs, NPs, and pretty much anyone that provides emergency medical care to children of any kind. So that's why I think that would be the best place due to my project being implemented in the emergency department. As for publications, I would consider publishing my work regarding this project in the Pediatrics Journal, which is the peer-reviewed journal for the American Academy of Pediatrics. They do accept quality reports and quality improvement projects, so that's why I think this would be a great journal to focus on submitting my project to if it were to come down to that. My practice recommendation includes intravenous magnesium sulfate use should be included as a primary intervention for pediatric asthma exacerbation in addition to current primary interventions. Today, I was able to go over with you my problem and my PICOT question, which involved the prevalence of asthma, and the PICOT question surrounding the use of magnesium sulfate to improve respiratory symptoms in children with an asthma exacerbation. I was able to show you the evidence which showed that IV magnesium sulfate helps to improve respiratory symptoms and as well as decrease hospital admission rates of pediatric children suffering from asthma exacerbation. My change model that I implemented was the diffusion of interventions model. The database evaluation reviewed how I would collect and evaluate the data that came from the change implementation. I then discussed the dissemination of my project institutionally, locally, regionally, and then of course national venues as well as publication. Thank you so much for listening to my project today, and please let me know if you have any questions. Thank you.